Hello. This research aimed to look at the components of successful performance of high-risk surgical steps. We were interested in the development and role that cognitive mapping played in preparing and executing these high-risk surgical steps, and how this might factor into surgical resilience and burnout. After a thorough analysis of the current literature, including its use in other high-stakes professions, our research team compiled a list of open-ended questions examining these themes. 12 one-hour interviews were conducted with surgeons representing a range of specialties and years of expertise. Interviews were performed using the constructivist grounded theory, with the results of each interview being used to guide subsequent interviews. These interviews were then transcribed and coded as a team to identify themes. Visual schematics were generated using the themes identified, pulling in direct quotations from each subject, allowing the team to draw a connection between subjects and themes and identify patterns of development for both cognitive mapping and surgical resilience. What we found is that cognitive mapping is a unifying skill across surgical specialties. This skill, while not explicitly taught, develops through residency and strengthens over years of surgical performance. Our study defines cognitive mapping as the ability to understand, manipulate, and navigate through a mental 3D understanding of anatomical space. Our subject described this skill as essential for preoperative planning, allowing them to appropriately plan for instrumentation, assistance, and complications. A robust set of contingency plans ensures that in the performance of high-risk surgery itself, our surgeons had the ability to be flexible in their approach, using their mental capacity to simply respond to what was in front of them rather than generating a plan in the heat of the moment. This detailed and complex level of preparation allows for improved emotional management during high-risk surgical moments, allowing for an action-centric approach with the execution of a preformed plan. The knowledge of adequate preparation leads to an improved sense of confidence and a calm demeanor under pressure. While experience was the clear gold standard for development, our subjects described a multitude of resources used in the development of both cognitive mapping and surgical resilience. Mentorship, in both positive and negative respects, was a consistent theme between subjects. Direct communication and observed behavior in the operating room significantly influenced the development of emotional management and personal responsibility. Experience, patient and peer influences, and a sense of personal responsibility all culminated into a culture of humility for our expert surgeons. This culture is what allows our surgeons to recognize the intrinsic risk of surgery and the inherent flaws of human action. This recognition allows for self-compassion and healthy emotional processing, protective factors against burnout. These skill sets build durable resilience for the length of a surgeon's career. At the heart of this development is intentionality and self-reflection. The lack of formal training requires self-direction and personal motivation. By nature, cognitive mapping and surgical resilience are mental processes that require self-reflection and insight into one's current abilities to help determine which areas require growth. This process is cyclic, with our surgeons continuing to practice intentionality and self-reflection as they grow their skills over the years. Cognitive mapping is an essential skill in proper surgical preparation and performance. This, in turn, informs the development of intraoperative and career-long surgical resilience. Residency was identified as a crucial time for the development of these skills. Through the development of the visual model, surgeons put words to abstract ideas and created a reliable framework that can be used in the development of residency curricula.